Funding for the Maddy Report is made possible by grants from BNSF Railway, Community Health System, Fresno State Associated Students, Inc., Harris Ranch Resort, Producers Dairy, the Spencer Family, and The Wonderful Company. Additional support provided by the Maddy Institute, the Public Policy Institute for the Valley's 4 public universities. This is the Maddy Report with Executive Director of the Maddy Institute, Blake Zanti.
Welcome to the Maddy Report. Today we're discussing the work of the Central California Public Health Consortium and the Central Valley Health Policy Institute and potential changes to Medicaid that could impact the San Joaquin Valley. Medicaid, known as Medi-Cal in California, provides health care to millions of California residents. On one hand, some lawmakers are arguing that programs like Medicaid and Medicare won't be touched in their goal to reduce overall federal spending. Others have argued that proposed federal cuts could have negative impacts on local healthcare systems. Joining us are Dr. Tania Pacheco-Werner from the Central Valley Health Policy Institute and Alyssa Kennett from the Central California Public Health Consortium. They'll help us understand the issue and discuss their work in public health. Thanks for joining us on the Maddy Report, Alyssa and Tania. Really appreciate you having on the show.
Yeah, good to be here.
Great. Well, let's dive right in. I know we have a limited amount of time. Alyssa, why don't we start with you? Can you explain the consortium's role in improving public health, and what are some of the big public health challenges that you're all focusing on at the consortium right now?
Yeah, Blake, so the consortium encourages a regional approach to public health issues. We're a collaboration between 12 counties in Central California, and work really closely with local health departments, their health directors, health officers, as well as their staff. And we know that public health resources are scarce, but public health challenges across the region are shared. And while each county is unique, there's a lot of overlap in what's challenging for our communities. And so a regional approach to public health issues frankly makes a lot of sense and can really help leverage scarce resources. Some of the biggest challenges that public health is facing in our region really centers around access to care. So, public health initiatives can only be so effective as people have access to clinical care. And so that's something that's it's complex, it's a system-wide issue, and public health is involved in trying to innovate solutions to healthcare access challenges because we know that that's critical to community health and population health. Some other things that I think are important to flag are a persistent challenge with chronic disease in our region, communicable disease, and environmental pollution.
Great. Well, and certainly to have that regional approach, you have to collaborate with local governments, healthcare providers, community groups. Can you talk a little bit about, your partners and how do you collaborate with all of the different folks who are involved in public health in the region?
Sure. So the primary vehicle that we use for regional collaboration is to engage stakeholders in regional work groups, subcommittees, initiatives that bring people together to really identify regional priorities in a strategic way. And so one example that I'll give is we've been convening a regional healthcare sustainability working group for just under the past 2 years, and this group brings together healthcare providers, local policymakers, public health leaders, community-based organization leadership, other regional associations, as well as philanthropy to learn together. These issues can be really complicated, and so it's important to have opportunities to learn about the issues affecting our region in the same space where the information isn't siloed, just in these really technical realms. So bringing folks together to learn, and then this group has also identified 3 strategic priorities for the region that we're working towards and having conversations about and learning about together. One of those is related to Medi-Cal reimbursement rates. We don't think they're high enough. Another is related to enhancing our medical education infrastructure. We know we need more providers, and not just physicians, other kinds of healthcare workers as well. And then the other priority that this multi-sector group has identified is innovation within the healthcare space. And a lot of those conversations have centered around community health workers.
Thank you. We're going to take a quick break. Up next, we'll talk more about the Central Valley Health Policy Institute. This is the Maddy Report. Welcome back. Now let's shift to the Central Valley Health Policy Institute. Dr. Pacheco-Werner, can you share a little bit about the Health Policy Institute and provide an overview of some of the work that you do?
Our mission is really to advance the region's capacity to be able to bring healthcare and health and wellness to everyone in the region. So we do that from taking what's called a social determinants of health approach, really understanding that for someone to be able to achieve health, they have to have stable housing, they have to have a source of income, and they also need to have access to the care that they need when they need it. And so what we do in that space is really trying to use our skills, being based in the university, using our research skills, using our collaboration skills with bringing people to the table, and really being a kind of translator between community residents and systems so that we all understand each other and our needs.
And what are some of the most significant health challenges facing the San Joaquin Valley from your perspective, and maybe what are some of the issues that you're specifically focused on at the moment?
Yeah, for me, I really see as our neighborhood as needing to be addressed, because when it comes to children, for example, the air that they breathe, but also the dangers that they have walking to school, things like that, all of those put them at risk, put their health at risk. So unintentional injuries are really big. Asthma is a big one. And for adults, it looks really different in terms of what they're struggling with is really the sum of both the stress and the lack of access to care for a lifetime, as well as lack of opportunities to really make better healthcare decisions. So they really are struggling with the chronic diseases that we know very well, like diabetes, heart disease, and stroke, which we know are all intertwined, interrelated, and really need a comprehensive approach to be able to combat.
When you talk about a comprehensive approach, certainly public policy plays a critical role in addressing some of the issues that you brought up. How can you just talk a little bit more broadly about, how does public policy affect healthcare outcomes in the Central Valley?
The decisions that are made in our halls of power will directly impact whether somebody can, if they don't have food on the table, can go to a food bank. If they need help with filling out an application to get medical care, that they have access to somebody like a community health worker or a social worker that walks them through that process. All of those funding decisions and program decisions are really made somewhere far away from the family, but it really impacts that person directly on whether or not they're going to have food at the table or be able to afford to go to the doctor when they need to.
Let's shift gears a little bit. I want to talk about some of the proposed current policy changes that certainly would have a big impact on the Valley if they were implemented. Medicaid changes. There are lawmakers who are talking about proposed changes to Medicaid. Maybe we'll start with you, Dr. Pacheco-Werner. Can you just talk about briefly what would hypothetically potential cuts to Medicaid look like, and maybe just generally speaking, what would the impacts be to the San Joaquin Valley? What populations maybe would be specifically affected the most?
One thing that I don't know most of us have access to that level of information is that our systems in the San Joaquin Valley are some of the most stressed systems in the country when it comes to there being enough providers inside the walls of hospitals to handle that emergency care, that hospitalization care, but also in the halls of like local clinics to be able to do that daily chronic disease management or that preventative care. All of those systems from top to bottom don't have enough providers and also are barely making it financially, which is why California has thought very thoroughly over the last couple of years, how do we make sure these systems don't fall out right from under us? Because they really are on the brink. And so when we're talking about already very stressed systems, all of a sudden enduring more systemic cuts across the table, it really takes out the bottom of something that was already very frail to begin. And so I think that people might think that there are some big reserves or that there's a way to make up for something that might come down from the federal level. And the fact is that we don't have that cushion here in the San Joaquin Valley.
Well, we'll continue this conversation in just a moment. We're going to take a quick break. Up next, we'll talk more about some of the challenges with potential changes to Medicaid and Medi-Cal in California. This is the Maddy Report. Welcome back. Before we went to the break, we started talking about Medi-Cal, Medicaid, and some of the changes that may be coming down the pipeline. Alyssa, I want to talk a little bit with you about, we were talking earlier about some of the stresses among the fragile infrastructure we have in the San Joaquin Valley. But what about, healthcare workforce impact? I want to dive into this a little bit. What would be the impact to the healthcare workforce if some of these additional changes were implemented or came into play?
Yeah, so there is a lot that we still don't know about what is being proposed at the federal level and how potential cuts would really roll out and how they would be formulated. What we do know is that if we assumed that the cuts were proportional to the number of folks in our region that are enrolled in Medi-Cal, Central California is looking at approximately a $28 billion hit. That's hard to come back from. We already have a difficult time recruiting providers into the region. Hypothetically, one of the ways that you could try to make up for some of that loss is to pay providers less. In a region where providers are already being paid less and they are facing higher patient loads and are often seeing patients that have more complicated cases, are seeking care at a later stage of disease. It's not an enticing prospect to recruit providers or other kinds of clinical services. And I think that when we think about a loss in Medicaid and Medi-Cal dollars, the first thing that we think about is people's ability to access services and find treatment. That makes sense, right? You have a cut, you're going to see loss of care. But I think that what we don't think through as often is the ecosystem and the economic driver that our healthcare system is, that our hospitals are. Hospitals in Central California, they get between 30 and 47%, so in some cases almost half of their revenue from Medi-Cal. To expect a hospital to be able to staff up appropriately and have the appropriate number of providers to provide the care that our region deserves to have with a reduction of about 50%, I mean, that's near to impossible. And so you'll see reduced quality of care. You'll see probably lower provider satisfaction, increase in difficulty recruiting those providers. And, having a hospital infrastructure, a healthcare system that is financially sustainable doesn't just affect those who are enrolled in Medi-Cal. That affects all of us, right? We're all using the same hospitals, we're going to the same clinics. It's a system, and if you lose a massive part of that system, that affects the entire population.
What I'm hearing there, I think, is maybe ripple effect. If there was a big, change that were to come to, the San Joaquin Valley, that there would certainly be a large ripple effect to our economy as a whole, not just to the healthcare workforce. I see you nodding your head, Dr. Pacheco-Werner. What do you have to add in terms of that ripple effect that could happen in the San Joaquin Valley?
Yeah, someone might look around their neighborhood and say, well, me and my neighbors, we're not on Medi-Cal. This won't affect us. However, now that I think about it, my neighbor is a nurse, and my other neighbor on the other side of the street has a business right across the street from the hospital. And if that hospital isn't there and those providers aren't there, that business is going under. And so really when she discusses the ecosystem, that's what we're talking about. But also, if I'm an employer and I've been relying on Medicaid for my employees to get health care, I'm now going to have a less healthy workforce if they can't access the care they need, and that's going to impact how much they're able to come in as well.
We're going to take another quick break, and then we'll be right back to continue this conversation. This is the Maddy Report. Welcome back. We're talking about Medi-Cal, Medicaid, and potential impacts to the San Joaquin Valley, and also some of the ripple effects that could happen to our local economy and our region as well. Aside from that, there are a lot of other public health challenges and healthcare challenges that we've referenced throughout the show. I wish we had 2 hours to talk about all these issues, but unfortunately we only have a limited amount of time. How are both of your centers, educating communities and reaching out to rural communities in the San Joaquin Valley to talk about some of these issues and really reach out to those different areas that may not have immediate access to care? Alyssa, do you want to just start with this question, then we'll go to you?
Sure. Yeah. Our local health departments and community-based organizations in each county that we cover, they're really the experts in knowing their communities and communicating with their communities and sharing really critical health education information. So a lot of the work that the consortium does is to support the capacity of local health departments and CBO partners to be able to communicate effectively. So we have a regional communications working group that gets together to learn from each other, to discuss the challenges of communicating in rural communities, Some of the things that we talk about are related to, making sure that communication is designed to meet the needs of the communities that really need to hear the information. So a lot of the times, health education information is kind of prepackaged, and maybe it comes down from the state level, but it's not tailored for our Central California communities, and especially for rural communities who may have limited access to broadband, who may not have English as their primary language. And so, we work closely with our health departments to identify where their gaps are and to try to fill those gaps as a region.
Thank you.
Yeah.
Let's turn to the Health Policy Institute. Dr. Pacheco-Werner, what are some ways that you reach out to different rural communities in the Valley?
So we've really tried to lift up how anyone can really be a driver of important health information. And so ensuring that in rural communities, community-based organizations, resident leaders have access to real-time accurate information has been critical, which has also led us to understand different strategies that people use to communicate with one another that are non-traditional, and really trying to communicate that back as translators that we are, back to the systems to say, your messages, is it reaching the WhatsApp groups that are really funneling information and sometimes misinformation? Sometimes for us, it is going into the different Facebook community groups and really saying, hey, here's the latest from the health department. You guys are talking about where you can get vaccines. Here's what the public health department says about where you can get those. So things like that have been really critical for us to really try to understand that people communicate differently in rural communities, and they're very tight-knit, and making sure that all of the systems are penetrating there one way or another, even if it's us doing that delivery ourselves.
On our final note, what other public health issues should Valley residents be aware of? We only have a few seconds left in our show, but Alyssa, if you want to take this question and to conclude and wrap up our show today.
Oh, where to start, Tania?
And you can both feel free to jump in where appropriate. Yeah.
Yeah, so I think, some of the things that I referenced earlier, chronic disease and communicable disease, environmental pollution, these are things that impact the daily lives of residents throughout the region. I think a unique and sad data point for our region, and I'll just use this as an example of some of the really persistent challenges that we face, is that the rate of congenital syphilis in Central California is 82% higher than it is across the rest of the state. We don't talk about this a lot, and it's preventable. And this is something that is related to access to healthcare, to transportation, to economic resources needed to have a healthy pregnancy, stable housing, things like that. And so this is just one example of a health outcome that we know can be improved in the region, but is related to something that's way beyond just clinical care or just traditional public health, right? It requires a social determinants of health approach, right? Acknowledging that there are a lot of things at play in Central California that require innovation and that require addressing things at a systems level.
Any final thoughts, Dr. Pacheco-Werner?
Yeah, public health is important, and across the country, we just lost $12 billion to support it, and that meant millions of dollars in our region. So we have yet to see the impact of that in our already stressed system.
Thank you. Unfortunately, that's all the time we have, but thank you both for coming on the Maddy Report today. I really appreciate your time.
Yeah,
Thank you.
That concludes today's Maddy Report. To learn more about the Maddy Institute, visit maddyinstitute.com. We'll see you next time. The views expressed in the Maddy Report are those of the individuals participating in the program and do not necessarily reflect the views of the Maddy Institute. If you'd like to share your thoughts about today's episode of the Maddy Report, please visit our website at maddyinstitute.com.